My name is Dr. Ngozi Ekeke. I work with German Leprosy and TB Relief Association, Nigeria. The topic is improving mental health and quality of life of persons affected by leprosy or Buruli ulcer in southern Nigeria. And the background and aims as outlined, the methods, designs of our study, preliminary results available at the moment, and next steps. For the background and aims, in Nigeria, leprosy and Buruli ulcer are often associated with high levels of stigma and discrimination, owing to their tendency to cause visible deformities. Over time, stigma and discrimination negatively impacts the mental well-being of persons with these diseases, resulting in depression and anxiety disorders. Again, in Nigeria, there is dearth of mental health experts. We have about one psychiatrist to 1 million population, one psychiatric nurse to 40,000 population. And presently in the National Tuberculosis and Leprosy Control Program, there is no provision for mental health services for persons affected by leprosy or Buruli ulcer. Therefore, there's need to explore sustainable ways to make mental health services accessible for these patients. The aim of our study is to determine the effect of community-oriented holistic approach on burden of mental disorders among persons affected by leprosy or Buruli ulcer. And we hypothesize that use of self-help groups, community-led counselors, and trained health workers will reinforce and complement each other in a synergistic manner for better mental health outcomes. The methods or designs for this particular study is a cluster randomized study in 10 purposely selected LGAs, which are clusters with the highest leprosy or Buruli ulcer notification in southern Nigeria. And we hope to establish self-help groups of persons affected by leprosy or Buruli ulcer, train local healthcare workers on mental health services, engage community-led counselors who will provide some psychosocial counseling. And at the end of the day, we hope this will improve the mental health, quality of life, and also social inclusion of these persons. Data tools that we are using include a PHQ-9GAD7 for depression and anxiety, social distance scale for social inclusion, WHO Paul Breath and Workable mental well-being scale for quality of life and mental well-being. And we going to assess the burden of mental disorders at baseline and also at the end of the intervention and end line. The same with quality of life and mental well-being for both the intervention groups and the clusters. So far, we have been able to do the baseline survey within the control group and the intervention group, and the preliminary results we have at the moment, a total of 635 persons affected by either leprosy or Buruli ulcer were involved here. And we have over 80% of the people with leprosy coming down with one form of depression or the other, and one level of anxiety disorders or the other in the study population. Again, the same also for persons affected by leprosy who have over 70% of them with one form of anxiety disorder and over 80% with one form of depression within the control population. And the same thing goes for Buruli ulcer. And coming to depression itself, within the study area, where we had 48.6% of them to be females, we had those with moderate depression and moderately severe depression on the high side, which are well over a quarter of these persons. But then in the control population, we have those with moderate depression or moderately severe depression, also taking more than a quarter or almost a third of the entire people surveyed. And then looking at anxiety disorders within the study area, we have most people coming with severe anxiety. And then in the control population, we have most of them with moderately severe anxiety and some with also mild anxiety. Now, the summary of all this is that within the study population, that we have 92.5% of the respondents with one form of depression or the other. And for anxiety disorders, we have about 80% of them. Then in the control population, we have 87% with one form of depression or the other, 77.8%. Some may wonder why we have this high level of depression. There could be many reasons. COVID-19 was there before now. And earlier on, we had a baseline that about 50% of persons affected by leprosy have one form of depression or the other. And we have from other studies as well that nearly half of patients in Nigeria who come in the outpatient clinics come down with one form of depression or the other. So relatively, the findings here suggest that most patients who have leprosy or Buruli ulcer have very high levels of depression and anxiety disorders. Next steps in the intervention, we have gone ahead to train health workers. We have trained some persons in the local or frontline health workers. About 53 health workers have been trained and 48 community lay counselors selected, trained across the 5 study locations. And this happened September 2021, and the activities have been on till the moment. The mental health interventions started by engaging persons affected by leprosy and Buruli ulcer to understand the need and to buy into it. We've enlisted these persons, and the formation of self-help groups had been well accepted since September 2021, and it's running up till this moment of the spring meeting. And again, we've had the persons affected by leprosy or Buruli ulcer to begin to share their experience of stigma, discrimination, and do a lot of peer counseling on how to cope with each other. And this concept was well received by them. So at the moment, 33 self-help groups had been established and their leaders set up, and the facilitators also trained, and the meetings are in progress. So far, over 120 self-help group meetings or sessions have been conducted, even up to the end of December 2021. Counseling services and other mental health services, including referrals, are ongoing in the intervention communities. And then we look forward that as the project progresses, over time, we're going to go into the post-intervention survey, which will cover both the study area and the control area. Thank you very much.